It's a pleasure to be able to talk about this study. This is a very important study, I feel, because patient satisfaction and the patient experience is something that all ophthalmologists and all doctors need to put on the top of their priority list. What we found is that the non-steroidal drop and the pressure patch group decreased patients' pain after the intravitreal injection. What we found is that the non-steroidal drop improved it, and it was actually statistically significant by decreasing their pain scores 6 hours and 24 hours after the intravitreal injection. So what we've learned from the study is if we combine those two, what we found is that the patient experience is markedly improved. And how do we know this? Well, patients who did not have this done in the past, who now have that done as our standard procedure, say they feel a lot more comfortable and can get back to work and really get back to their normal daily activities after the injection much faster than they could prior to implementing these procedures. Colleagues that are not using any techniques to improve the patient experience, may I stress to them that the future is going to be in the patient's experience and patient satisfaction. The online reviews, the reviews that patients fill out for Press-Ganey scores are going to be reflected in terms of how they give their intravitreal injections and how much emphasis they put on the patient experience. So I would tell them to look into this and to take note of the patient experience and try to make the patient's experience as good as possible. So if the patient experience is poor, it doesn't matter how great the medicine works if the patient doesn't come in for their treatment. And we see this all the time. Patients fear going blind, but they also fear the pain of the treatment. So let's see if we can do something to decrease their fear of the pain, which will get them to actually potentially show up for their injections and feel better about their care. The worst thing we can do is have a patient non-compliant because of something we did or something that we actually have control over in the future to improve their experience.